Welcome to Smut, did you say? Hosted by Nurse Nikki in association with Queerlana. Before we begin, please note that the views and opinions expressed are those of the host and guests and not necessarily Queerlana as a whole. This podcast is for educational and resource purposes only. It is not intended as medical advice, legal advice, or a substitute for professional care. Because of the nature of healthcare work, we may discuss heavy or sensitive topics, including mental health struggles, suicide, sexual assault, death, or violence. Listener discretion is advised, and this podcast is recommended for adult audiences age 18 and older. If you are in crisis or need immediate support, please reach out to a qualified professional or call your local emergency number. Okay, on to Nurse Nikki.
Girls and gays, ladies and gentlethems, it's time to answer Smut Did You Say? Where we'll expose ourselves to uncomfortable truths, plow into some pillow talk, and get those burning questions looked at. I'm Nurse Nikki, she, her. Today's guest is Cindy. Please introduce yourself and tell us smut we're talking about.
Sure. My name is Cindy Lemburg. Pronouns are she, her. I'm a licensed clinical social worker, I provide mental health outpatient therapy. My primary areas of focus are this weird cross section of queerness, people who experience minority stress and trauma, and neurodivergence.
Awesome.
So, yeah.
So Cindy and I met a couple months ago at a conference where we both spoke about our key focuses, where I shared stuff about advocacy within the hospital, and she talked about her specialty as far as especially this link between neurodivergence and gender diverse population, or the queer population in general, but particularly the gender diverse population. And you shared a lot of really interesting things, which I think a lot of people can connect with, because I was thinking about it after you were talking, and I think every trans person that I know is on the spectrum somewhere. So if you want to talk a bit about the research and your practice.
Yeah. So let's start small scale first. So I have been doing outpatient therapy since 2018. And this focus on queerness and neurodivergence is actually an offshoot from work my wife, who's also a therapist, had already started doing. And she had been in private practice for a couple of years before I joined her, and started to notice herself she was focusing, her specialty has always been autism since the beginning of her professional career. And she started to notice, sort of unofficially, there was this link with her clients between a lot of her autistic clients were expressing some sort of gender diversity. And she started to look into it. And then it was right around that time that we started to learn about some national research that was being shared. The first time I heard it sort of officially was at a conference for US PATH, which is the Professional Association for Transgender Health. And they were highlighting these, the correlation, this overlap between the gender diverse population and autistic population. And that has continued to just sort of grow and expand. The study that I cite the most often, that I cited when we met at that conference, there was a large scale study. This is in the early 2020, maybe late 2019-ish era, that studied about 500,000 individuals who expressed some sort of neurodivergence. And when you split that out, on average, about 5% of cisgender individuals were identified themselves as autistic, and about 25% of individuals who were gender diverse identified as autistic. So there's this crazy increase in neurodivergence when you look within the trans and gender diverse population. So
yeah, well, plus I think that even if they don't have an actual diagnosis, I think that a lot of them would find that these behaviors that they thought were told was weird about them was actually a neurodivergent trait. Because, when I found out I had anxiety, I always knew I was anxious, but I didn't know I had anxiety. I would panic and get really, really overstimulated, and that was diagnosed as anxiety. And then later on, I was talking to my provider, and I was like, I think I have ADD, because
exact
anxiety
same
medicine,
situation.
yeah, anxiety medicine wasn't working. And so I was like, it would work, and then it wouldn't. And then certain situations, I always describe it as this level where with without anxiety medicine, my tolerance was down here. With it, it's up here, but there was still this space where being an ER nurse, like shit gets up here all the time, you know?
Mm-hmm.
It was just too much. And it
Yeah.
wasn't that I couldn't handle the stuff at work. It was like the sounds and like the constant barrage of like people interrupting you all the time, like that kind of thing was bothering
Yes.
me. Mostly people not answering their call bells and monitors. I'm like, do you not hear that?
Right.
Just tune it out.
Right.
Must be nice. But yeah, so that kind of thing. And I was like, I'm really like overstimulated. Like, do you think I need ADD medicine? And she was like, yeah, we can try it. So I got on Adderall and I was like, well, there you go. Or
Yeah.
not Adderall. What am I on? Vyvanse.
Yeah. One of those. It's fine.
And
We're all the
yeah,
same.
well, yeah. I got on Vyvanse and because I always thought that because I played around with Adderall in college and it made me hyper focus on all the wrong things, that I clearly wasn't ADD because taking Adderall that wasn't prescribed to me didn't work. But I mean, that's what happens when you take meds that aren't
Right. Right. Yeah.
tapered and taken correctly, because we definitely were doing some things that you shouldn't do with that. But
Yeah. Yeah, I had a
everybody
similar
does it.
experience.
Yeah.
I used to joke around. So I have people who joke I've had like 15 different careers. My first early career as an adult was a teacher, and at that point, I started to joke around that I had ADHD. And then when I met my wife in 2012, it was her best friend who's also a therapist, and he was like, does Cindy know has ADHD, or do we need to like tell her, or
Yeah.
like what's
Yeah.
happening there? But
And you're like, "Oh, no,
not
I
long,
don't. I
and I
don't.
was
I
like,
just don't."
no, I was actually like, well, that actually makes sense.
Yeah.
But I had the anxiety thing, which is a very common experience for people who are socialized as female, assigned female at birth. Typically, it's very common to have neurodivergence, ADHD, and autism misdiagnosed as anxiety, just because of the way that we're socialized to sort of, present ourselves and express ourselves and
Yeah,
whatever.
we're supposed to be, like, not as hyper as boys, and
Right.
if you kind of get towards that way, then you have anxiety or whatever, but no,
Yeah.
not ADHD, that's a boy thing.
Right. Well, yeah,
And not
we
autism,
typically.
because you can make eye contact.
Right. Don't get me started. We
Yeah, I know.
typically, for whatever reason, we typically internalize things. And so it's our brain that is, it's very common. Externally, it looks like I'm completely calm and just hanging out, and you have no idea what's happening inside this brain. And so it gets misdiagnosed as anxiety. And I had a very, very similar experience as you with being on anxiety meds first. And they helped a bit, but it
Yeah.
was the ADD meds that actually like.
Because I think that you truly are, I mean, or being ADD and being undertreated for it will make you anxious.
Yes,
because
absolutely.
because being overstimulated all the time makes you really, really anxious. It's like, and you just keep getting told you need to really work on like not flying off the handle so fast. You need to think about things before you do them, stuff like that. And I was very impulsive and I was
Hmm.
doing a lot of really dumb stuff, like racking up a ton of debt, a bunch of like risk behaviors. And they were like, oh, you're bipolar too. And I was like, I don't get depressed though. And I don't
Yeah.
get manic.
Yeah.
So, or even hypomanic, really, from what I would think. But I was like, I feel that, uh, if I am bipolar, I feel like it's psychothymic where your day has ups and downs,
Hmm.
but I mean that's ADD,
Yeah.
you
Turns
know?
out. Yeah.
And probably a little bit of the tism, maybe. But
Yep.
now that conversation where it used to be like, do they know they're ADD? Now it's like everybody's like, do they know that they're
Do they know they're
autistic?
a bit
Because
autistic? Yeah.
yeah, and then like you said, don't get you started on the whole eye contact thing, but that is not how you diagnose autism.
No, and one of the things
It's a
I've gotten
factor in some, like,
in some.
scaling.
Yeah.
Yeah, but,
Um, and yeah, and it's one of the things that I've gotten most sort of my own hyper focus about is
yeah.
the way that research and data and diagnosing and all of it within the autism sort of world has been so specifically geared towards cis white males.
Mhm.
Um,
Oh,
and
well,
so
that's crazy.
yeah,
Why would they
right?
focus
What?
on them?
What? That never happens. Not
Never.
not here. Not only are from assessing and diagnosing, working with autism, not only are we missing cis females forget about anybody who's gender diverse. Like, that's
Right.
not,
Yeah.
yeah. And so,
We don't
yeah, and
matter.
so everybody has like a picture in their head of what does autism look like and what are all the things like the eye contact thing or the various special interest things and what those things have to be. And
Trains. It's always
it's
trains
always trains and Lego, always.
or comic
So,
books.
right. And so my wife and I have had conversations about, a lot of times we'll have clients who are either cis female or somewhere that's I only work with queer folks, so
Right.
gender diverse in some way. But
That's fun though,
and then
because
yeah,
queer
I
people are
know.
so I love being around them all the time. Like, if I could hang out with only queer people all the time, I would. Sorry, mom.
Anytime a client shows up who's like cis and or straight who doesn't have a partner who's queer, I'm
Like,
like, how did you find me? Like,
yeah.
how did
Where did
this
you
doesn't
find
really
me?
fit. Anyways, but my partner and I will talk about, we'll get clients who will, come to us and be like, well, I'm diagnosed with depression, anxiety, social anxiety, OCD. And it's like, how many labels do we need to throw on one human before we
Right.
start to go, maybe it's just autism? Like,
Well, and there's such a stigma about autism.
yes.
Like, you look at like back in the day it was Asperger's, right? So
Yeah.
like you had that uncle or whatever, or be like, oh, he's a little spurgy,
Yeah.
and it was just this super weird, can't hold a job, lives with parents, or has to be checked on all the time, like somebody who is not able to function in society independently. And that's just not true about the autism spectrum,
Mm-mm.
not the whole thing.
No.
And so yeah, it's just really interesting how I feel like we've come really far in trying to figure out more about autism, but we're also really stunted, like you said, and the research is
Yeah.
only on cisgender males. But what can we do as far as getting the research on board? Just having more people and like um, different genders involved and
So
different
I think
races.
one thing that I think has been really important that I've seen, even just locally in Charlotte, is the number of mental health clinicians who are also self-identifying, whether it's formal diagnosis or not, it doesn't matter, as autistic or neurodivergent.
Okay. Yeah.
That that makes a huge deal because there's, I mean, just as in any sort of, subsection of the population, the people who are sort of like running the show should be the people who are those people who are doing the research about, whatever the thing is.
Yeah. Yeah.
And
Absolutely.
yeah, and
And
so
making the
that's been,
decisions about it and the
yep,
legislature and
yeah. And so that's been, I don't know. I'm not involved in huge research projects, so I don't know how that's happening on a larger scale, but I definitely see that locally.
yeah,
Um, and, um, and then even just there are different I feel like I'll speak personally, I'm learning more and more about the sort of varied experience of autistic individuals and learning more things about like RSD, which is rejection sensitivity dysphoria, or PDA, which is pervasive demand for autonomy. And these things that I think have been overlooked as unimportant, these kind of characteristics
or just
of
being
the
sensitive or
autistic experience.
yeah,
Yeah. So, um, and then talking about it like we are, and the presentation that you saw me do, I've done a few times in different circumstances, always heavily focused with advocacy for the queer community, but just sort of making the space to say, hey, this is a thing. And then hopefully, if you're talking to 25 people, 7 of them go, well, that was interesting. And then they tell some people, and,
right,
it can go a
yeah,
long way.
yeah, for sure. So let's talk a little bit about your work with the trans community,
Yeah.
specifically with PATH.
Yeah. So PATH is, it stands for providing access for transgender health care.
Yeah,
Ooh.
I'm pretty
Yes.
sure that's what
I'm
it
pretty
is.
sure. So it's a grant funded program that is offered through CTH, which is the Charlotte Trans Healthcare Group. CTH is a nonprofit. It's been around since 2012, I believe, and it started as like 6 healthcare providers who were in the Charlotte area who all had a special interest and focus on serving the trans community. And it has grown. Last I heard, there was like 90 members, therapists, psychiatrists, primary care doctors, surgeons, massage therapists, voice coaching. Like there's every kind of like healthcare professional you could think of in this group. And then a couple of years ago, we got a grant, a very large grant actually, to provide access to healthcare for uninsured and underinsured individuals who financially would be unable to. So right now, PATH is able to provide therapy, psychiatry, primary care services, some assistance with medication, um, paying for the prescriptions. So yeah, I'm a PATH provider, and yeah, it's been really cool to be a part of that, just knowing the need that's out there.
Oh, absolutely.
Yeah, because
Are you able to share where the grant comes from?
if I knew the answer, I would.
Okay.
So it's government related. I don't know all the details about it because I just it just shut up. I know that there is some sort of partnership involved with Duke because I have to provide information to Duke about the billing and things. So I
Yeah.
think there's like a partnership in the managing of the funds with Duke and CTH. I don't know all the details. Don't quote me on any of it. I don't know whether the funds originated from federal grant money or state funding, but I know that there's some sort of government involvement in where the funding comes from.
Where do you see that going from House bill bullshit, whatever it's called, to the future?
So the grant that we have right now is only providing care to adults. Well, I believe it's 16 and above. So most of the bills and the legislature being focused primarily on kids. We haven't seen a ton of impact for most of the PATH participants. There was, I believe, and again, not in charge of this, but I believe that there was some concern, like for a minute, when the current administration went in office and the federal administration, and there was the onslaught of executive orders, and there was one or maybe a couple that impacted the nonprofit work and USAID stuff. And I think there was like a second of wondering whether we were going to be impacted from that. We weren't. Um, I think that the funding is guaranteed through a certain point this
Okay.
year, next year. I don't know what the date is. So
So
then
they would
beyond
just,
that, who knows?
yeah, so if this becomes law, then they would just say you can't do it for anybody under 19 or
Probably
anybody who's
yes.
new. Okay.
Yes.
So as far as that, speaking about that, we talked a little bit before we started recording
Yeah.
about the law. The House bill itself states that you can't do it for anybody under 19 or anybody who started their therapy after August of 2023. But it sounds like that certain organizations are discontinuing it in general if they're under 19.
Yeah. So there's you have all the state level stuff happening, but then there's also a lot of fear from the federal government around there's I mean, to be quite frank, doctors are afraid of being sued. Like they're
Yeah,
afraid of losing their license. And so I think organizations are circumventing that fear um by
by just saying we're
shutting
not doing
down
it.
medical care and saying, well, we're just not going to do this at all because the risk is too great. In North Carolina specifically, I know that there has been at least one large lawsuit brought against some healthcare providers. I don't know where that stands. I don't know enough details to talk anymore about it other than I know it exists. And so I have heard other doctors locally in Charlotte from this is all medical doctors. So far,
Yeah,
mental health stuff, knock on wood, people are
right.
leaving us alone for the most part.
Yeah,
But yeah, so it's all medical doctors. And I've heard local doctors in Charlotte being legitimately afraid of like, well, what does this mean for my license? So yeah, there have been organizations that have completely shut down healthcare for minors. And it has not been because of an actual law. It has been because of
right.
fear of future
The threat
laws.
of a
Yeah.
law.
Yeah.
An executive order, which is not law until
Right.
it's passed by
Right.
I was never big on the whole, like, government stuff in high school, but,
Unfortunately, we've all had to learn a lot in the last
yeah,
little bit.
right? Like,
Yeah.
I didn't care. I honestly didn't care about
Yeah.
politics at all until 2016. And so until 2016, I was like, "Yeah, whatever. It's gonna suck either way. Like, politicians are politicians." And then I was like, "Oh, well, there's harm in in not in not understanding what's happening in the government." Like,
Yeah.
you
Yeah.
can hide in the sand for as long as you can, but there's a point where things become important,
Mhm.
and you kinda have to take a stand and say, like, I'm not standing with that, I can't." And so, uh, like you said, this is not a real law that people are reacting to. It is a fear
Mhm.
of this statute within this law that says that you can prosecute a medical provider for performing a service to a transgender person who later regrets it.
Mhm.
And that's for 10 years.
Yes.
I don't know if it starts at a certain point or whatever, but that as far as I know, it's 10 years, and I think that it would be a good idea to talk to a lawyer on the show because I that legalese stuff is so hard for me to read,
Mhm.
but, I did b read the House bill when it was first introduced, and it just made me really, really mad, and I
Yeah.
was seeing red for a bit there. If you read the stance from the person who actually presented that bill, he has nothing but anecdotal
Mhm.
anything to say. First of all, it's biblical, what he
Yeah.
has in there. Second of all, it's like, well, some people said that they got sex change surgery and then they were like, "Oh, I shouldn't have done that." And it's
Mhm.
like, okay, well, first of all, that's less than 1% of people that
Yes.
happens to. That was the biggest thing where I was like, he doesn't even know what he's talking about. And that's like so many of these bills that have to do with healthcare because gender affirming care is healthcare. Getting people off of their hormones that they've been on is going to be detrimental not only to their mental health, but also to their physical health. Because
Yeah.
you see what happens to women in menopause, that's going to happen to everybody who stops taking estrogen.
Yeah.
And with testosterone, I'm not exactly sure because there's not a lot of studies, but just like a lot of older men that have lower testosterone are depressed and whatever, and that's why they take testosterone some men, and it
Mhm.
is gender affirming care even if you are cisgendered male and you're taking testosterone. So
Mhm.
good on you for making that not
That
happen.
will never be a problem.
Oh,
It
no.
is,
They're gonna
yeah.
find some way around it, but
Yeah. Yeah, and the evidence that is placed in bills is typically anecdotal. It is never based on actual researched evidence-based information from legitimate healthcare sources because any
well, he
legitimate
didn't even
source.
cite his sources. He just
Yeah.
said a bunch of stuff,
Yeah.
and he didn't even say where he got it from. He was just like, "Some study said this,"
Yeah.
and it's like, "Okay, what study? Where? Who did
Well, yeah,
it?
because it
Like,
doesn't
how many people
exist.
were in it?" Like,
Yeah.
yeah. Ugh, that's
Um
nice. Show me the data.
Yeah. Yeah, it's been really fun to it's always great when you specifically talking about kids because 'cause they've been so heavily targeted.
Oh,
You know,
yeah.
this whole entire trajectory of the trans healthcare
Well, they wanna save
conversation.
them. They wanna save them.
Yeah, and there's this notion that kids get to just show up one day or parents get to say like, "Well, my kid's trans, so like, you know, provide a
Cut it
surgery
off.
to change their body," and it's like,
Yeah.
"Hi, y'all don't know what the trans community is going through just to get basic healthcare." Adults, forget about the kids and what
Do you
they,
think your kid's gonna go to school one day a girl and come home a boy?
Right,
Like, that's
right,
what
because that's
that's what
such
I
an
was
easy
hearing.
process. Yeah.
Yeah. You go
Mhm.
through a lot of therapy to determine, like what you said when we talked about it before, are you trans or are you traumatized? And and,
Yeah. Well, that I was
or both.
talking more about never the trans thing, always the conversation of autism. We
Oh, yeah,
like
yeah.
yeah, people come in and there's this overlap of symptoms between autism, trauma. A lot of people come in misdiagnosed as bipolar, and it's like, well, that's none of those.
Yeah.
Yeah, the gender thing is my personal attitude is that that's never a question. I have in the past had parents who will bring their kids in for therapy with me, and so the parents know I don't mince words. I am 100% affirming. If you're bringing a kid to me, they are going to be affirmed. We're not
Right.
questioning things like,
Yeah.
but a lot of parents will say like, well, I want you to help them figure out, like, are they really trans? And and then the parents will, I'll start having sessions individually with the kids, and it's like, no, are you trans? What? Yeah, great. Yes, great.
Right.
Tell me about
Yes.
what else
Okay,
is going on
cool.
in your life.
So
Let's
trans
like,
basically always
yes,
traumatized, basically.
100%.
Yeah.
Yes.
Yeah.
But there's
Um,
even this notion of like that somehow the therapist is going to help someone figure it out. That's not the case. We are helping them figure out how to live in this world that doesn't believe them.
do you need to appear a certain way
Yes.
to make yourself feel like you can live again, that you can
Yes.
live, that you
Yes.
can continue to exist in this world?
Yes.
Do you need to be somewhere in the middle? Do you need to go all the way? Do you need to have reconstruction of this or that? Or do you
Yep.
need to change your name? Like what basically you are saying, what can I do, or what can I help you work through to say I can continue living?
Yes. That is,
So,
yeah.
yeah.
And a lot of the work has to do with also educating the parents, the caregivers, family members, whatever, teachers, of not associating the things that as a society we have decided define a gender, not
Mhm.
associating that with someone's identity. So
Right. Or
someone says,
worse.
well, child who was assigned male at birth is saying I'm a trans female, but she's still wearing pants. And it's like, well, I wear pants every day of my life. Don't bring me a skirt. And no one questions my gender. So it's some of that, like, breaking down the
What is this, the 1840s?
right, like, or, oh, but she says she's trans, but she, doesn't like Barbies. Great. Congratulations. She doesn't like Barbies. She is still female because that
Yeah.
is who she is.
Well, and
Um,
people are like, I can't, are they male or female? I can't tell. Does it matter?
yeah, yeah,
Like,
yeah.
it doesn't matter if you can tell. Well, I don't know what to call them. Ask them.
Ask.
Okay.
Just ask. It's not that
Yeah.
big of a deal. It's really not that
Yeah.
big of a
And
deal. Yeah.
I've asked cisgendered people what are their pronouns before, and they're like, oh, I'm not trans. And I was like, I just
That's not what I
was.
asked you. Yeah. Yeah.
But that brings me back to it being so important to ask people their pronouns in an
Yep.
emergency clinician situation, because like I'm not an ER nurse anymore. I switched to case management, but being an ER nurse for 7.5 years, not asking people their pronouns and gender and if they're taking hormones or not and anything like that, or if we have to do a pregnancy test, things like that. Ensuring those kinds of things is just, I don't understand why it's not just part of the check-in process.
Mm-hmm.
Um, because I was talking to my last guest about patient autonomy, and respecting somebody's identity is the basis of patient autonomy. You
Mm-hmm.
have Maslow's hierarchy of needs, and you have survival basically underneath, and identity is the very next rung or part
Mm-hmm.
in the pyramid. Like, you need your identity to feel like you belong somewhere. So we were talking about how if you come into an emergency room, and like, say for instance, I come into emergency room and they're referring to me as he, him, and calling me Nicholas or whatever, and I'll be like, well, that's not my name and I'm a woman, and they'll be like, oh, whatever, I don't care.
Yeah.
Why would I want to listen to anything that they say?
Yeah.
And then especially throw in that whole, like, I'm going to call you what's in your government license thing back in people's faces. I've literally heard a provider say that to a patient before, and I was like,
Yeah.
you don't call me what's on my government license.
Yeah.
You call
Yeah,
me
I
my
think
name.
one of the thing I've heard people speak about before that is not true at all is equating someone who's gender diverse and the name they have chosen for themselves.
Yeah.
So I don't use the words like preferred name because that gives
Yeah,
the notion that it's
I'd
an
say
option.
name.
It's
Yeah, yeah,
just their
yeah.
name. So
Yeah,
their
yeah.
chosen name, it's their name. But
Chosen
people,
name. Yeah, that's a better way
yeah,
to say it.
people want to treat the chosen name like it's a nickname. And
Yeah, it's not. It's
it's
their name.
not. And so my name, I go by Cindy. What is actually on all my legal documentation is Cynthia. I have never
Yeah.
gone by Cynthia in my entire life. My mom doesn't even call me Cynthia when she's mad at me. Never. However, When someone calls me Cynthia, I don't have any feelings of anxiety, dysphoria, thoughts of wanting to harm myself. That doesn't happen. It's just kind of annoying because it's not what I go by, but like, whatever I tell you, I
Yeah,
go
you're
by
just like,
Cindy
"That's not my
and we
name."
keep it
Like,
moving.
that's not you can call me Cindy.
You can call me
Like
Cindy. Right.
yeah,
But I
exactly.
also, my license says Cynthia and it's fine.
Yeah,
Um, and so when someone says that a trans person's chosen name is the equivalent of a nickname, it's taking away all of the distress that people feel when confronted with their dead name. And Cynthia is
yeah,
not my dead name because I don't
no,
have that experience. And I think that sometimes in medical practices, that's kind of the attitude. It's like, well,
yeah.
it's,
Because when you in the chart, it says preferred name when you change their name, or it says alias.
one of the things that I do, and I've when I've talked to other providers, like in organizations, a huge thing that you can do is to just give the person the heads up. You're going to see your dead name. So,
Yeah,
example, I bill insurance. If a
yeah,
person has not changed their name, their insurance gets billed under their dead name.
yeah,
But I give my clients the heads up of every single circumstance when they're going to see their dead name, which is never, unless I have to, usually it's me writing a letter for surgery or something, and I
yeah.
have to put their dead name at the very top. And I'm like, heads up, dead name's at the top. It's the only place you're going to see it. You
But
know,
it's not you you wanna make sure that they know it's not you ignoring it,
it's not me ignoring
it's
it. And
you having to
it's also me saying, like, heads up, I don't want you to be surprised. I don't want you to be shocked.
yeah,
I don't want you to be
no,
like already, you know, going through it and having a day. And then you open an email from your therapist and it's like, well, fuck, dead
yeah,
name.
yeah,
I don't want that to happen because in circumstances where people have not had the ability to, or even the desire necessarily to change their name
mhm,
legally, it doesn't mean it's not important that we
no.
can't respect that process for them.
Yeah, and that was another thing that I was gonna talk to, either a lawyer or somebody who's changed their name just about how stupid that process is.
It is.
Because if you get married, all you do is go into the Social Security office and you say, "Here's my marriage certificate, here's
Yeah,
my ID, and here's my Social Security card. Can you change all this?" And they're like, "Oh, yeah."
yeah,
I was helping a friend of mine who just turned 18 look at the name change stuff,
yeah,
and I was like, "Okay, so it looks like you gotta get your fingerprints done," which I don't think you need to do if you're married, if you get
no,
married and change
no,
your name.
you don't.
Yeah, 'cause, I mean, I've been fingerprinted, but I think it was just for nursing school.
Yes,
And so you gotta get your fingerprints done, you gotta get your birth certificate, and a lot of people don't have their birth certificate because if you don't get along with your parents or whatever, and your
yeah,
parents have all your crap, you don't have it.
yeah. Yeah, I've helped plenty of clients navigate that process. At one point I
Yeah.
created a flow chart. But what I've also learned is that the process can differ from county to county.
Oh,
What
really?
is written is not different, but the
Uh,
way that the local government entities interact with the folks, or it can be different. So like I have lots of clients who change their name in Mecklenburg County. It's annoying but relatively painless.
yeah, because it's
Because
a
it's just
more
it
liberal
yeah,
area,
it's
yeah.
just they just check the boxes, people show up, everybody in the courthouse is super used to it, it's not a big deal. I have one
Yeah.
client who's been trying to change her name in Iredell County for 2 years and can't get it done. It just keeps running into roadblocks, and, "Oh, we changed that form, so the form you submitted is no longer valid." That client was able to get facial feminization surgery faster than she was able to change her name in Iredell County. I think that the reason behind someone who's changing their name going through all of that is because a person who's changing their name to be gender affirming is treated the same as a person who's changing their name to avoid prosecution.
Oh,
And
I
so it's going through all the steps. The fingerprints are to make sure you don't have a criminal background that people aren't aware of. The posting your information at the courthouse is making sure that no that you don't people have the opportunity to sue you for money that you owe them. Like it's things like that. It's
but,
like
like, your maiden name is
yeah,
linked with your married name, so but if you fill out anything, it's like, do you have any names that you've been known by in the
yeah.
past? And then why wouldn't that just cover you in the
I don't
same
know.
way?
I don't know. Obviously,
Whatever.
because it's not logical, but that's the sort of like if you were to ask, like that's the reason that the law existed. Yeah. The way that it does.
Again, treating people that just want to live their lives and feel
Yeah.
like a normal person as criminals.
Yes.
Ugh.
Yes.
Um, So speaking specifically to people who are trying to figure out where they can get care for
Yeah.
certain things, speaking as a nurse who works for an organization in the major Charlotte area, I
Uh-huh.
am not speaking about this as a nurse who works at a particular organization. I'm speaking about this as a educated nurse who has worked in emergency services for 7.5 years,
Mhm.
regardless of what organization that was for. So there's been a lot of new stuff coming up about Atrium specifically
Mhm.
no longer providing gender affirming care to individuals under 19,
Mhm.
regardless of when you started your gender affirming care. I've seen that it's just in North Carolina, and I've also seen that it's across the entire advocate scope, but it wouldn't make sense
That
if
I
this is
don't
just a
know.
state thing because
Yeah.
advocate spans multiple states. There was a petition saying that it was all 6 of the states that advocate had hospitals in, and I
It
don't
might
know.
be because of the risk coming down from the federal government, but I have no idea. I
Yeah,
just know I
or
just know the
doctors that
local.
could potentially work at more than one
Yeah.
in more than one state or something. So again, it's not a law, but there is this statute where they can sue a doctor
Mhm.
for 10 years or whatever if
Mhm.
they give care to somebody who later regrets it, which again is like 1% of the population. And it just means that the doctor themselves wasn't doing a good job to make sure that this patient was truly ready or
Mhm.
truly understood the process. This is
Mhm.
why informed consent is so
Mhm.
important, and this is why having vulnerable populations, which transgender people should probably be on the vulnerable population list, but this is why it's really important to have like advocates present. This is really important to have patients teach things back to you the way that
Mhm.
you have said them, like what do you understand that we're going to be doing, what risks do you understand, instead of just being like, here's this form of a bunch of words, sign it, this is to say I can do your surgery. Well, that's not
Yeah.
all it's saying.
No.
So I think spending more time with patients and going through exactly what is involved and what issues might come from it, and what to do if issues are experienced, because I think that there's a huge lack of educating patients before there are certain procedures. And I come from the emergency world where a lot of the consent that we do is implied because it's an emergency and things need to happen. So, or it's like, a lot of times with like surgeries or other procedures, you can't have anything to eat or drink for X amount of time. And if that's not met, then you don't get the procedure. Well, that doesn't happen in the ER. If you need your gallbladder out because
Oh,
it's going
yeah.
to explode, you need your
You just
gallbladder
do
out,
it. Yeah.
So I'm not familiar really with the informed consent so much in the primary care
Yeah.
setting. Be wary of medical providers and advocate for yourself. And if they don't, you need a second opinion. I tell people all the time, I don't understand how people who aren't in the medical field know how to advocate for themselves, because I was having trouble
Yeah.
like being as educated as I am. People don't know about a lot of these issues that people have. People don't know about what tests are done at what age, and what tests are done as a reaction to what things, and how if you want certain testing to be done, you have to like be really forceful about it.
Mhm.
And I would hate to tell people to be like forceful with their doctors, but I mean sometimes you really just have to be like, this needs to be done. And then if they continue to refuse, you gotta be like, "Well, I guess I'll find somebody else." And doctor hopping is not as like, it used to be, like, a really bad thing, and unless you're trying to get, like, narcotics or, like, something controlled, I think that doctor hopping is perfectly reasonable.
Yeah.
Um, you need
I
to find somebody who you mesh with, and same with therapists and
yeah.
everything like that.
So I'll speak personally. I personally had always sort of been under the impression that, especially when it came to, like, primary care doctors, for whatever reason, I don't know why, I just sort of assumed that, if you get along with them, then it's fine, and if they tell you, "Yes, you can have that," or "You need that," then sure, you believe them. And then
Yeah.
over the last couple of years, I had to fire my last doctor because it became very clear that that is not the case. And I do think my last doctor was a great doctor. She was not the right doctor for me. And I felt like I wasn't being listened to and was kind of being dismissed. And And I don't remember what the like catalyst was that made me say, forget this, I'm not doing this anymore. And I went to a different doctor, and it was this weird experience where my new doctor, who I now see and adore, she's a great fit for me. But the first meeting appointment with her, having a doctor just be like, oh, okay, that I believe you. And I'm not going to ask you a million questions like, well, have you thought about maybe you need to lose a few pounds, or what's your
Right.
diet? She was just like,
I'm
oh
not
no.
doing a Mediterranean diet. Leave me alone.
Right, like,
Ugh,
go away. I will every once in a while, I will eat ice cream and french fries. This is what is happening in
yeah.
my life. But then I walked out, and she was just like, "Yeah, no, that's unacceptable. Like, we will do this test, this test, this test, and then our next steps will be this, and this," and
Yeah.
made referrals to appropriate specialists. And but then I walked away and was like, that was surprising to me to have a doctor validate me in that way, and that is sad that that was surprising. Um, and so that is a thing, I think. So for trans and gender diverse individuals, autistic individuals, there is a whole slew of common co-occurring medical conditions
Mhm.
that autistic individuals experience, and a lot of them are really hard to get diagnosed, often not believed, blah blah blah. And so what you were saying about, having to kind of be forceful or advocate or doctor hop, I it is very, very true that, like, if you walk in and a doctor says something that indicates that they don't believe you, well, then that doctor's not for you. Like,
Yeah.
that's not they don't have to, 100% validate your WebMD search, because obviously
Right. And
that's
that's
never
what I was gonna
appropriate.
say is
Yeah.
like being in the ER, I see a lot of people being like, this is what's wrong with me. And I'm like, well, the ER is not the place for this. If you want to go down this route, you need to go to a
Yeah.
primary care doctor. And because the ER, what people don't realize about the ER is that our main focus is to rule out life-threatening
Yeah.
emergencies. And if we do that, we don't always give you a diagnosis.
Right.
We just know that your belly pain is not a
Right, that you're
ruptured
gonna live
appendix
for the next
or
few weeks while
yeah,
you can go to the
yeah, like,
doctor.
but you
Yeah,
need
yeah,
to go see a
yeah.
specialist, and I realize that that's not possible for a lot of people or that it's gonna be
Mhm,
challenging, which is why I think that case management needs to exist in all ERs and see every patient or at least
mhm,
be available for every patient in the ER, but that's a whole thing. I've suggested that before, and they're like, "Yeah, we've tried that, it didn't work," and I'm like,
mm. Well, then clearly that was the final answer. Yeah,
okay, like, that's how science works,
yeah.
whatever. So, speaking about, telling people to go to their primary care or a specialist, are there resources that are available for people who are in any group of people who are underrepresented or not cisgendered, straight white men?
Yeah.
Um, like, what are their options as far as where to get care, whether it's mental health or physical? And
So
especially with people losing Medicare and Medicaid too.
yeah, yeah, that's fun. So, CTH, the Charlotte Trans Healthcare Group, is definitely one. All the providers, members of CTH, we have profiles on the website. Basically, to be a member of CTH, you have to not just be a healthcare provider, but there's
Yeah.
expectations that we are getting training. Should we go to meetings? There's some oversight to say, yes, this is a safe human. We're constantly communicating back and
Yeah,
forth
it's not
about,
just somebody who can be like,
you you can't just randomly show up on a list. You have to, like,
yeah,
show up
okay,
and do things. And
that's
there's
good to know.
like a listserv. We're constantly communicating about, people's experiences, and especially when people find really good experiences, we'll share those resources. If you have one healthcare provider that you trust, do not be afraid to ask that person for their recommendations for others. Clients ask me all the time for recommendations for everything under the sun, and I am happy to help provide that, because I would rather, if I have at least some positive experiences or knowledge, or, a lot of times, a lot of positive experiences with people, it's easier than a Google search. There are also within Charlotte, and I know that I am sure that this is true on a larger scale, but there are resources in Charlotte for the trans community specifically. So for all ages, for kids, there's the Gender Education Network.
Mhm,
Time Out Youth is for adolescents.
absolutely, and they're a great resource.
Trans United Charlotte is for adults. There's a nonprofit. Well, they're not officially a nonprofit. There's a group. It's a mutual aid group called T for T. But these are all queer focused and queer, a lot of times queer led organizations. A lot of
Mhm.
them have Discords. Be a part of the Discord. You will find out who's good and who's not good because people talk. And
I didn't realize that there
100%.
was Discords. I'm
Yeah.
not up on Discord being used like Facebook and whatever.
Yeah, no.
Um,
So the Gender Education Network doesn't, I don't think, has a Discord.
okay.
I know Time Out Youth does, and it's for kids. It actually started during COVID. The adolescents can sign up, and then the adult ones too. And I don't know if they started during COVID or before COVID, but
Yeah.
those have definitely become a great way for people who, for whatever reason, a lot of times just because it's awkward to like go to an event cold, knowing no one, and just show up and be like, well, this is weird, you know.
Yeah.
Um,
Yeah.
Sign up for the Discord, and I always tell people you can just like, watch the conversations and,
Yeah.
get to know
Yeah,
people that way.
just check in with it every now and again,
Check
and
in.
Discord has little tabs where
Yep.
it's like, this is for shameless self-promotion, this
Yep.
is for sharing experiences, this is for general things, this is for memes,
Yep.
and, it makes sense that it may have come up around COVID
Yeah.
because
That's when everything.
you
Yeah.
needed that community, and you needed to be able to talk about things, but you couldn't go out and talk about things. And like you said, it's just awkward to
Right.
show up in an event where you're like, "I need help, and I don't know who to ask." And,
Well, and if you just look at the high rate of autism within the trans and gender diverse community,
yeah, you're not going to
socialization,
events, like,
social
that's not your
interaction,
thing. Yeah.
fuck no, absolutely
Yeah.
not. Like,
And you
um,
might just not even talk in the Discord, but you
no,
can
you don't
see the
have to. You
information.
can just
Yeah.
see, and you can and you can look, and you can then make the decision. It's sort of like Discord, those Discord channels being a really good way to have a lot of control over what your interactions are.
Yeah, you can also, like, whisper or, like, direct
Yep,
message people, so,
yep,
like, they say, "If you have questions, let me know." You can pop into their message and be like, "Hey, I saw this, I don't wanna ask in front of everybody," or
right,
whatever.
right.
That's an awesome resource. I didn't even think about that.
Yeah, yeah, there's
Yeah.
those are the ones that I know of. I'm sure there's others out there.
And whether or not you live in Charlotte, like, these Discords
Yeah,
are
yeah,
things
there.
that like, you don't have to, like,
N
partake of their services.
No,
But, I mean, they do have people who manage the
like
page that
moderators,
would
they all have moderators.
moderators
Yep,
that would eject people
yep,
if there's something inappropriate
yep,
or some troll ends up in there, because 'cause I'm
yep.
sure that happens, but
Yeah, they all have
yeah.
moderators. Charlotte Trans Health, to circle back to that one, so CTH has case managers. Path, I think they're all specifically associated with the Path program, but,
Yeah.
um, CTH also has case managers who will assist in getting people linked and connected. We have sort of loose affiliations with a few lawyers in the area if there's assistance that's needed with name change stuff, financial planning, will planning, all of that kind of stuff. There's a couple
Making
of
sure
lawyers
that
that.
you're your kid's legal guardian
Yeah,
or
yeah.
whatever if you're not their birth parent.
Yeah, there's
Yeah.
a couple of lawyers who will do periodically. In fact, I think there's one happening this month. We'll do kind of updates for the CTH providers as a group, so we get some information there as well. So the downside is that there are people and organizations and groups that, of course, are ready and willing to provide whatever assistance, but the level of help available is never going to meet the need.
No,
So it can be
never.
really difficult. It can be challenging. I know that there's a lot of requests that come in for housing support, and that is
Yeah.
one that there is not a good answer for right now in Charlotte. Like, there
No.
is not. Um, Unfortunately, people are still going to run into a lot of barriers, but there are people out there ready and willing to provide whatever help.
Yeah, and to the best of their ability too, like, even
Yeah.
if you can't find somebody a permanent situation, maybe you could find them like, "Hey, this is a safe family you could stay with," or
Yep.
something like that, because I think they have a similar network to the women's care desert type of thing where, people will help you get across a border and give you a place to stay and, things like that. There are people who care enough to be a resource to be
Yeah.
able to help people.
Yeah.
And like Cindy was saying, these that she mentioned are in Charlotte, but there's a lot of that kind of thing in Winston-Salem as well, in Greensboro. I know particularly in Winston-Salem, it's North Star
Mm,
for youth. And then Queer Lina, who's doing this podcast,
mhm.
has a bunch of resources on their site. I have a bunch of resources that I put together personally as well, and that they're going to put those together in like a booklet and have them available if people want them. Um, And I don't mind sharing the PDF for people if they want it. One other thing that I wanted to talk with you about is just like advocacy in life and in the profession. Like obviously you are a person who people come to knowing that you are queer and that you are
Yeah.
neurodivergent yourself and that
Yeah.
that's what you specialize in. But for other people who come across this population, which is probably everybody,
Yeah.
what would you recommend for promoting advocacy?
For other professionals or patients or clients or
Anybody, just everybody. Because like for professionals, it's going to be different, and it's scary with all the laws that are going on right now. Like people I know are worried about getting sued, but you can't get sued for sharing resources, and you can't get sued for showing support.
yeah, I think one thing
Um,
is to I think I personally take a lot of responsibility for, and I think all professionals should, is keeping yourself educated. There have been a
Mhm.
couple of of instances just over the last couple of weeks that I've had personally, um, interacting with other healthcare professionals who have some pretty significant misunderstanding of what's happening right now,
Or just
and
don't know that it's happening at all.
or don't know that it's happening at all. But for
Yeah.
the I don't tend to interact with those folks. But for the
Yeah, me
most,
neither.
but it there is, but I think that it's really important, um, because if you are not keeping, as a healthcare professional, not keeping yourself well informed and well educated, and are then spreading misinformation, it can create a lot of chaos and panic for a patient or client unnecessarily,
Yeah,
um,
or for other healthcare
or
providers.
for other healthcare providers, who then have
Yeah,
to circle back and say, well,
yeah.
the
If they care enough to look
right, right,
for information.
right. And I just think it's okay for, if you know, as a person who's seeking treatment or care or support, if you know what you're looking for, to not feel like you have to settle. So like we are talking about the overlap of gender diversity and neurodivergence. It's okay to say, I am not going to be okay with seeing a provider who's only knowledgeable about one over the other. Like,
Oh,
I have to
absolutely.
pick either you
Yeah,
know something about autism or you know something about gender diversity. You don't have to settle for that. You can expect both. If you see a provider and you ask them a question about, you know, you want to help with RSD, and they're like, well, I don't know what that is. Well, then that may not be the right provider for you. Or,
right.
um, I had a client, this is forever ago, like way, way back in the beginning of therapy. I had a trans mass client come in, and we were kind of talking about like, positive, negative experiences with past therapists. Cause I
Mhm.
don't want to make the same mistakes that somebody got pissed off by
Right.
something. What worked, what didn't work. And this
Yeah.
client said like, well, my last therapist, I decided that I needed to stop seeing them because they had to ask me what a binder was. And this is a trans mass client. It's like, well, if you're working with trans mask folks, knowing what a binder is day one, lesson one. Like,
Yeah.
that's not even into the weeds of things that you
No,
might,
not even a little bit.
not even,
That's
that's
literally on the outside.
literally day one, lesson one, you know, body
Yeah.
dysphoria, would a binder be helpful? And that just hit me in the face. Oh, I never want to do that to a client. I never want to be the
No.
one who doesn't
No.
know the basics, the bare
That's
minimum.
another thing about taking care of gender diverse individuals in the psych setting, in the
Yeah.
psych ER setting,
Yeah.
is we have to take their binder off.
Ugh.
And so what I was talking to somebody who needed a binder, it's because they have the clippies. They have metal on them.
Do cis women have to take their bras off?
Uh-huh.
Okay, just checking to see if it
Yeah.
was
Oh,
equal.
yeah, yeah,
Got it,
yeah,
got
yeah,
it.
for sure.
Yeah.
Because of the underwire and the
No, that
clippies,
makes
yeah.
sense. Okay.
And even a sports bra. So for women that are well endowed, I know a lot of women don't like to free ball it basically
Yeah.
because it's uncomfortable,
Yeah.
it hurts. And so there are things that we can do to make patients more
Yeah.
comfortable, and understanding those things, like you can do an ACE wrap.
Yep.
You can tell them, you're going to have to be watched probably. I mean, you're going to be one-on-one, but you having an ACE wrap, everybody's going to know that you have an ACE wrap just so they know. So there does have to be some education between, and some compromise between you and the patient of
Mm.
what's acceptable for their level of need at that time. But one thing that you can do is those maternity panties, you can cut the crotch out and then they're just
Oh,
a
yeah.
ring. And so make them like a tube top.
Yeah.
And if you do a couple of those or tie it in the back, that's a binder
Yeah.
or that's a bra. So I had a young girl who really, really, really didn't want to take off her bra because it made her feel really uncomfortable. And I was like, honey, I will make you one, but I'm telling you, this is something that we have to do for everybody. We
Right.
cannot make concessions about
Right.
these kinds of things.
Right.
And I said, but I'm not going to sit here and be like, that's the rules. We're not
Right.
doing it
That's
any
not your
differently
feelings
and
don't
screw you.
matter.
Yeah, exactly. So like you said, binders are really important. And it's um they did add the transgender population to the trauma education
Mm.
for ER providers, but I don't know that they talked about binders because that's like what don't cut off somebody's binder if you don't have to. Like those
Right.
things are really expensive.
Yeah, they are.
And it's
They're
also
really
part of
fucking
their
expensive.
affirming care. They're gonna
Yeah.
want it back. Potentially if they have rib injuries, it's gonna actually help them,
Yeah.
like
Yeah.
so yeah, just different things. Like we cut off people's expensive clothes all the time and I feel bad, but like their clothes, you know,
Right.
and a binder can be replaced, but like for a kid who's
The
16 and maybe got hand me down
I
from
was gonna say the
somebody
kid
and they
may have
don't have
gotten that binder by accident, like, just a
yeah,
happenstance. They're not
yeah,
necessarily gonna
and
get
they
another
don't have
one.
access to another one
Yep.
and their parents aren't gonna buy them one,
Yep.
so just be thoughtful about those kinds of
Yeah.
things. For trans women, I would say keep in mind that their breasts are going to be tender. I mean, not
Mhm.
that we're feeling people up, but remember when your breasts were growing,
Right,
like
right, right.
that's what it,
Right. Unless
you
they've been
know,
on hormones for a while, they're in
yeah,
the
for
same
a very long
position.
time.
Yeah.
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 And privacy and dignity, don't be like, oh, there's a penis there, like you can be surprised if they didn't disclose it or if it's like a trauma thing or whatever and you don't know anything about the patient. But I mean, just don't be a dick.
Right.
Like,
That you know what?
and
That is generally speaking my first rule of thumb of
yeah.
interacting with other humans. It's like, just don't be an asshole.
Yeah,
Like,
and,
let's
like, you
let's
can
just try
uncover
that.
you can uncover somebody's genital area and be surprised about what you see, but we're supposed to be able to school our expressions pretty well to not make our patients feel uncomfortable, and so you can be like, "Oh," and then just you can
Yeah.
just go from there and ask the questions and be like, it's like, I'm so sorry I didn't ask you about this ahead of time." Or if the patient's unconscious, obviously put it in a note to be like, "We don't know the patient's gender or name or anything because they were unconscious when they came in,
Yeah.
but there is evidence that this patient is not cisgendered. So
Right.
when they wake up,
Like,
like this needs
ask.
to be a
Yeah.
conversation that happens." Yeah.
Yeah.
And that's a good way of advocating for patients in the field, even in
Mhm.
the emergency field. And I've been told several times that in an emergency situation, it's not important and blah, 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 blah. But there are several articles in the Journal of Emergency Nursing specifically that talk about patients' experiences in the ER when they were dealing with true emergencies and how the biggest takeaway that they had was that their gender wasn't affirmed
Mm.
or that they weren't called by their name,
Mhm.
So like that makes a big difference.
Mhm.
And you want these people to trust you and do their follow-up appointments and go to what they're supposed to go to and whatever. And they're just not going to do that if they don't trust you.
Right.
If somebody comes up to me who has a MAGA hat on or something and gives me a suggestion about like a store I should shop at, I'm not going there. I
Yeah.
can tell that you're not in
Right. We
this
may
with
not see
me,
the
like,
world.
we're
We may not see the
yeah.
world in the same way.
Yeah,
Yeah.
exactly, like, we are at odds, and I'm not gonna take your recommendations for things, so think about it in that way if you are intentionally disrespecting a patient. There's another thing about, like, if you don't ask patients' pronouns and shit in triage, they may not have it in their chart, and then you walk in the room and you may be the first person to ask them, or you might not ask them because you're busy and you're an ER provider and that's just not what you're thinking about at the moment. And then it comes out later and you're like, you have to backtrack and be like, I'm so sorry, I'm not that person. I promise you, I'm not that person.
Yeah.
And I've had to do that to people before where I didn't look in the chart before going in the room because sometimes it's just I have 50,000 things to do and I'm just going to walk in there and do what I need to do and then you realize that you were dead naming them or whatever and you
Right.
have this like you're safe with me shit on your badge
Right.
and stuff like that. And I was like, I wish you would have told me. And they're like, I wish you would have
I
asked. And
wish you
I'm
would
like,
asked. Right. right? Do
Touche.
you, and that's a fair thing where if as providers we're thinking like, oh, I wish you would have told me. It's like, well, do you walk in and, automatically introduce those things about yourself? If as a cis woman, I don't like,
No,
you
I
know,
don't, no.
yeah,
And I really do I call most people love, and so I just kind of leave gender out of it anyways,
yeah,
and that was a suggestion that I had on one of the little badge reels that I made for healthcare professionals was use gender
neutral.
neutral
Yeah.
language to begin with.
Yeah.
Like mate is fun.
Mhm.
I put comrade on there because I thought that was silly. Probably not appropriate at the moment, but it could be. But love is a good one.
Yeah.
People say friend,
Yeah.
buddy. When you'll get assholes that are like, I'm not your buddy,
Right.
pal.
Right.
You
Right.
know?
Right.
It's like, all right, so but that's ER. So I'm sure it's everywhere, but that's my experience in the ER is sometimes they're like, don't call me that. I'm like, I am sorry. What would you like to be called?
Right.
And you can say that to anybody,
Yeah.
but it was suggested to me by some people in the DEI council at the organization that I was at the time that I should not ask people their name and pronouns unless I think that they are gender diverse or non-binary. I was like, oh, so profile?
Right. So
You
we're gonna
want me to
profile
profile?
a group
Yeah.
that's already othered. Yeah.
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 So no, don't
Yeah.
do that. Just ask everybody. If that's what you're
Yes.
gonna do, ask everybody.
Yes.
And if it's not what you're gonna do, I would really hope that you would, but I understand being nervous about it with the political climate. If a patient freaks out on you for asking their pronouns, I would just assume that they're not actually having an emergency and that they could probably leave.
Yeah.
And you can step out of the room and say, I can continue triaging you when you are ready to be respectful. You can ask security to come in the room. You can call risk management and see what they suggest. If your clinical supervisor or your charge nurse is supportive, you can ask them, supportive of you in general, not just the gender
Right.
diverse
Right.
population, but nursing is kind of like high school. So sometimes you have a charge nurse, so you're
Right.
like, I'm not going to them with this. You can talk to your charge nurse, you talk to your manager, you can talk to a house supervisor. Risk management is an excellent place to talk to, or call a chaplain,
Mm-hmm.
because chaplains historically are kind of just accepting and neutral to everything. So another thing I was going to say is that in the presentation that I did at the conference that we were at, I talked about ways to stay up to date about laws affecting transgender youth or transgender people, but specifically transgender youth in the area. And I will link that, and it's nationwide. You can click on any state and
Mm-hmm.
then put in specifically what you're looking for, and that can help you understand what may be going on in your area. And then as far as like medical stuff goes, if you have questions about what is acceptable or what you can get in trouble for, risk management, just send them a
Mm-hmm.
message, and you can ask the chaplain and say, if I have a question about the ethical nature of providing care to a patient where laws are involved in curtailing my ability to do that, where are the boundaries?
Yeah. I
And
wonder.
as far as nursing goes,
I was gonna say
it's
risk management is that would be something that's like a corporation specific, right?
yeah. So I think as far as I know, every healthcare organization has risk management. It just might not be called that.
Yeah, but
So
so
like,
beyond that, it's also good to keep in mind that all licensed professionals have, so like I have to have liability insurance, and through that,
yeah.
I have someone to call who's not being paid for by a certain
Oh, yeah, yeah,
corporation,
yeah.
but
So if
is
you're like a travel nurse or something, you would have your own liability insurance
yeah, and I think
usually.
like I can't do my job without liability insurance.
Yeah.
But because then that takes away, because you have to separate, you have corporations that are going to make decisions that corporations make, and they may or may not be in line with the ethics of a certain licensure. And so separating out like my corporation says I should do this because of the corporation views, but my license alone, right, says
Yeah.
these things. So I mean, I just work for a company with my wife and her best friend. We are not,
Yeah.
uh,
Yeah, and you
you
don't
know,
have to worry
but
about
you don't have
that.
to worry about
Well,
that. But if I
thinking about
did,
that,
yeah,
yeah, a good thing to do would be to know where your corporation stands
yes,
on that, and then to go to the state licensing board who has their
yes,
own expectations, who you are supposed to follow your company's so you have like umbrellas. You have like your
Yeah.
company umbrella, and you have like the state licensing board umbrella, and you have like joint commission umbrella for healthcare professionals. And so you could say, my organization told me this,
Yep.
and then the licensing board would be like, oh, that's not okay. And then you'd be like, okay, so I'm reporting that
Right. So
my
then what are my next?
organization,
Yeah.
like, what are my next steps?
Yep.
So another thing that I talked about in that presentation, which I can also link when we share the podcast, is that you have the American Nursing Association and the American Medical Association, specifically for doctors and nurses and practitioners and stuff like that, has a very clear ethics policy
Mm-hmm.
about what kind of care and anti-discrimination that you should be providing.
Mm-hmm.
And if your organization is keeping you from doing that, that's not okay,
Mm-hmm.
because they are under the umbrella of the Joint Commission. About 80% of hospitals in the US are under the Joint Commission. And the Joint Commission has a very strong anti-discrimination standpoint. And if your healthcare corporation is keeping you from like providing resources or speaking about being gay, or speaking about patients being gay, or advocating for respect of patients, that needs to be reported, absolutely. And if your organization isn't going to do anything about it, keep reporting it.
Yeah.
There's a whole chain that goes up to federal licensing. As far as the Joint Commission is not federal, and it's not government.
Mm-hmm.
It's just a governing agency for healthcare professionals. But like I said, they have a very strong anti-discrimination standpoint. And you can also make a stir about it with a professional nursing organization.
Mm-hmm.
So for instance, if the ER where I was working was like, nobody wear rainbow pins and nobody do this and nobody do that, I would be like, all right. And so I would go all the way up the chain. And if nothing was done, I might reach out to the ENA and say, hey, this is what's happening in my ER. What can I do about it? And just get resources that way, for as far as being a medical professional.
Yeah.
As far as mental health providers, what is your Joint Commission?
So
Like
every
your
mental health provider, they have a license. So I'm a licensed clinical social worker, LCSW.
Yeah.
So I have a licensure board in North Carolina, but then there's also the National Association for Social Workers, which is
Yeah.
just the larger advocacy network. And each license has that. So it's kind of a similar thing where I don't work for a corporation. I used to work for a large agency. And so it would be, yes, I have like the agency policies, and then I have my licensure policies. And if those are in conflict with each other, then it's discussing with the licensure, entity themselves of, okay, what do I do? Like,
Yeah.
um,
Yeah. Like, I
and
don't know
yeah,
what my next
I don't
steps
know what
are.
my next
Yeah.
steps are. And then, yeah, I mean, that's probably for mental health professionals. That's, yeah, we all have our own licensing boards, that we have to
Yeah.
pay money to every whatever years, and,
Yep.
do what they say.
Say, yep, I'm still doing it.
Yeah, still doing what I do. And right now, those are, in some cases, a lot of cases are individual states. They're working on interstate compacts, so it'll be
Okay.
closer to a national thing. Psychologists who that's PhD level, they already have an interstate compact. The LCSW one is pending. Who knows? I don't know where it
Yeah.
is in this process. But yeah, but right now it's state by state
Okay.
oversight thing.
And then I think we're going to wrap up in the next couple minutes.
Yeah.
Is there anything else that you feel like the listeners really need to know about
I
things
think
that you're doing?
the only other thing, I'm just gonna circle back in this weird thing of from an autism perspective, assessment and diagnosis. So formal diagnosis is traditionally really expensive. It can
Yeah.
be, there are
I've heard
ridiculous
that.
waiting lists for good assessors, and it can be really expensive. It is, some people feel it is super necessary to get a formal diagnosis, but I also want to point out the validity of sort of self-identification. I think that there are providers who have very strong feelings about sort of like, oh, people just get on TikTok and think they diagnose themselves, and like,
Oh, they find people that have the same
right.
issues
And
as
really
them,
what you
and
did
they
is
say, oh,
you found some And I'm not saying that everything you see on social media is valid. Obviously, there's some like
No, but I mean, like, some
insanity out
things
there.
are like, "Oh, they see me."
But
Like,
right.
I feel seen, I'm in this post, people say stuff like that,
Yeah.
yeah.
And so,
Ugh,
and kind of along the lines we were talking before about doctor shopping and, feeling really strongly about like it is important to find people who will validate you. If part of your journey has been using social media in that way, and then you go see a provider or therapist who's like, well, TikTok means nothing. There are therapists out there who will say, tell me what you learned on TikTok. Let's like dive into it.
yeah,
Let's
let's
really
get
go
into
there.
that,
Yeah.
and
Yeah.
let's fill in the gaps,
Um,
or
Fill in
let's
the gaps,
validate some things.
correct misinformation, validate the good
Yeah,
information. Yeah. Basically, my the overarching view is between autism and gender affirming care that people know themselves the best. And it's okay to walk
yeah,
in and say, I know who I am and I would like to talk to you about that.
yeah,
Full stop.
yeah,
Full, like, that's it.
100%.
Um,
Yeah.
that is 100% what people should expect from their healthcare providers.
Absolutely.
So,
One thing I will add to that is that if you yourself are dealing with issues from things that you think that maybe I am autistic and
yeah.
maybe this is why I'm struggling with XYZ, certain organizations will, if you ask for accommodation through disability,
Yep.
they have to pay for you to get formally diagnosed if they require you to
Ah,
have a diagnosis
yes.
rather than just a doctor's note that says my patient struggles with XYZ, please accommodate with
Yeah.
this. Like I can wear earplugs at work,
Yep.
the hollow ones, because I can still hear with them in, but it doles out
Yep.
a lot of this extra noise that apparently people tune out. And then I also wear sunglasses kind of at
Hmm.
work. They don't get super dark unless it's really, really bright in there.
Yeah, I support people through. I don't see as many kids as I used to. Definitely have written many a letter for 504 and IEPs. Yeah. But then for adults, I do this more often now. Even if you don't have a formal autism diagnosis, but you feel like you do need accommodations from work, and you have a therapist, talk to your therapist about it.
That if your organization requires that you get a formal diagnosis, they have to pay for it.
Yeah.
I would
Sometimes
look up their disability policy just to make sure, but the one that I'm speaking about, they say that they will pay for
yeah.
it.
Yeah. So it's not something that you should just walk around and be like, oh, I have to live my entire life with these fluorescent lights and I can't absolutely say anything about it.
No,
And like to,
they're
yeah.
awful.
Yeah. So no,
I'm like, "Can
just
we turn these down?" And they're like, "It can't be dark." And I'm like, "Well, then it's gonna be dark just in my
in my
little
little world. Right.
space,"
Yeah.
you know?
Yeah.
Anyway. So I would love for you to share whatever resources you have for helping healthcare providers
Sure.
learn more about autism and any research that you've found,
Sure.
learning more. Like you said, if you don't know what RSD is,
Yeah.
like, and you're dealing with patients that are either autistic or neurodivergent in some way, you should know what
Yeah.
that is, you know?
Yeah.
And
Basics.
so in my resource booklet, I have things for nurses and doctors to improve education about LGBT care, but I would love to expand that and
Oh,
say
sure.
there are more things that we could do a lot better at in supporting people and helping people just survive,
Find what they need.
you
Yeah.
know?
Yeah.
Yeah,
Definitely. I
exactly.
can do that.
Yeah, so we can add that. We'll link it in the page where we share it on Queer Vision, and
Hmm.
we will also I'll add it to my resources as well. And then yeah, we'll try to get this ball rolling of people knowing what they're what they're
Yeah.
doing
Definitely.
and what they're experiencing.
Yeah.
All right. Do you have anything else to add,
I
Cindy?
don't think so.
All right. Well, tell us where we can find information about your practice and where we can find, well, we talked about Path and stuff already,
Yeah,
but
so,
if you'd like to
I
share about your
I
practice.
didn't actually name my practice, huh?
No, you
So
didn't.
I that's
You
really
did
funny.
not.
So my practice is called Halcyon Mental Health. It's Halcyon, Halcyon Mental Health. It is, like I said, it was started by my wife and her best friend. It's super small. I don't have a huge social media presence, so that is the way to go. CTH, if you look up Charlotte Trans Healthcare, you'll find us. I think that's it.
Okay. And we'll put the link to your practice
Yeah, yeah,
as
yeah.
well. What is it?
Create your calm.
Calm your mind. Create your
Create
calm.
your
Yeah.
calm.
Okay.
Yeah, it's
Okay.
yeah, the tagline for Halcyon is create your calm.
Yeah.
So
Yeah.
like
Yeah.
they both go hand in
Okay.
hand. So yeah. Yeah.
Well, like I said, anything that we talked about in this edition of the Smut Did You Say podcast will be linked below. And if there's anything missing, feel free to send me a message or to message Carolina and say, hey, they talked about this. I wanted to know more about it.
Cool.
And we can absolutely get you more resources. So That's what she said. Have any titillating topics for the future? Still have burning questions from today's discussion? Feeling frisky and now you want some action? Slide into my inbox at smutdidyousay69@gmail.com to find out how you can get in on this. And follow Queerlina for a link to education and resources related to today's topic and updates about our next show. Good night, my little smut heads.
Thank you for listening to Smut Did You Say? You can find links and resources mentioned in this episode in the description below. For a downloadable PDF of Nikki's resource handout, along with additional emergent support options for queer individuals, visit queerlina.org/helplines. That's QUEEROLINA.org/HELPLINES. Take care of yourselves and each other, and we'll see you next time.